people underestimate what pain does to you mentally. You make decisions based on pain. You don't want to let people down, whether it's your wife or your children, but pain is real. Why would you give up 1 minute of quality life if you don't have to? 1977, I had my first knee surgery. It was due to high school football injury, and I had my meniscus cut out, something they would never do today. So now I started dealing with knee pain from 1980 on. I'd go see an orthopedic, and he'd say, okay, well, you've got some bone spurs and a little arthritis. We can go in there and shave it out. And then 5 or 6 years later, I'd get another scope. In golf, confidence is everything. And I had so much knee pain that I always felt like I had this chance of collapsing or buckling. I didn't have confidence to go after the ball. I didn't have confidence to get to my left side. So over the years, I started to compensate. I started to get less on my left side, and I started hitting more from my right side.
Arthritis can be debilitating. It can limit somebody in their daily activities. It can certainly limit somebody in the things that gives them quality of life. Whether it be an activity, a sport, even just walking around the block. Somebody's in pain, debilitated, a swelling joint, a painful joint, a weak joint. The quality of life just isn't there.
I think I love the game of golf because it's kind of like the game of life. It rewards you for hard work, teaches you how to handle adversity. It's a game of honor. It's a game of integrity. I like the fact that I can go out and play with 3 of my friends, but I also like the fact that I can go out by myself and enjoy the game just as much.
This is a game that you can play for years and years, and the reality of it is the interest hardly ever wanes, but sometimes physically things start to get in the way, and when you see that, the swing starts to take its toll a little bit. There goes distance, there goes accuracy. Golfers are a weird, confident, egotistical bunch, and I'm one of them. Don't make me go ask someone else for help, because that's admitting weakness. And this game, when you get out there and you're playing old man par knows if you have a weakness, and it's very hard to let that out of the bag. So that is a reality of why people hesitate to go feel better and play better.
And I kept saying there's got to be a better way, a better implant, a better procedure. And I did a lot of research, and I would see Dr. Berger's name come up on YouTube or Google. But the one thing kept sticking with me was he kept saying there's got to be a better way. I went through the best process, was literally sending me emails. They sent me a notebook of where to stay, where to go, where to eat, what to expect, what medicines you're going to take. This is why you're taking this medicine. If this happens, you're going to take that. It was very detailed, so much so that it gives you a level of confidence that not just him, but his whole team is involved. I was all in because they were all in.
The whole program that Dr. Berger put together, he does emphasize, proper nutrition and exercises and strengthening before you have the knee replacement. This procedure particularly, that there's not as much trauma. The approach makes sure that you're going to have less complications or less limitations immediately post-op. So you could get back to your activities quicker.
3 hours after surgery, a physical therapist came to the room. She said, let's walk around a little bit. And I'm still in the hospital. And we did. And she says, well, let's try some stairs. And I'm thinking to myself, this is not what other people have told me. And I probably know 10 or 12 people that have had knee replacements. And none of them have said that.
I've been doing this 27 years. So, seeing literally thousands of knee replacements, I've been impressed with what I've seen with Teddy's recovery.
His mindset was one where I'm going to be able to do this right away. And there wasn't a hesitancy, whereas some players go out and go, let's not do too much too fast. Let's try and hit some soft, maybe 50-yard shots or 60-yard shot. Let's not do too much. When you can get a player that goes through something as Teddy went through with Dr. Berger, and to do it and kind of go, there's no flinch there. It's going to be fine. That's confidence for a golfer. You bring in the mental state that he walked back into the game with, and then you add in the physical state to go, I always knew I could do this. I didn't know what was holding me back. Now the only thing is he's got to find a hat that fits his head because his confidence is really big right now.
I'm hitting the ball a little further. I'm hitting it a little crisper. Joe and I were out, and he showed me a couple drills. I couldn't do those drills before because my body was in a position that my knee wouldn't allow me to get to. And today I did every one of them, and I had no pain. And after I did the drill, I hit the shot, and I'm like, he just showed me something that's going to help me in my game that he couldn't show me or I couldn't execute prior to knee surgery.
The coolest thing about Teddy is he just always talks about it, and he goes, I can't believe this. I can't believe it was so simple. I can't believe I was prepared so well for it. And physically, I can't believe I can do things I haven't been able to do in 8 years, and I can do it in 2 to 3 weeks.
If to give up 3 weeks of your life to have the surgery and some rehab is going to give you a lifetime of enjoyment, do it now. I went to a doctor who said there's got to be a better way. He came up with it. He came up with the procedure. He came up with the tools, and he had a belief. And I believed in him in his way. And I did my part. He did his part. And I'm living proof of it today.